Welcome back. Well, we have Kaiser Permanente here, and representing Kaiser Permanente is Dr. William Wu, and he is the Assistant Chief of Family Medicine, and you also are a family practitioner out of the Euclid offices of Anaheim, correct?
That's correct. I'm a family doctor first and foremost, taking care of my patients every day, and family medicine assistant chief as well.
Now, we were talking a little bit earlier before we came on, and you got into diabetes because of some of your patients. Tell me what effect that had.
Yeah, so practicing family medicine, I was able to see the impact that diabetes had on my patients and the population around my clinic. Mm-hmm. And I thought it would be very important to help shape the quality that we provide in terms of healthcare to our diabetic patients, help form the policies and how we go about taking care of diabetes.
Okay. And you said that you represent the doctors,
yeah.
But not just the ones for diabetes, for all doctors.
Correct. I'm the Assistant Chief for Family Medicine, so I represent the frontline doctors. Mm-hmm. I help to make sure that we provide quality health care to all of our patients.
Okay, fantastic. Let's talk about what type of diabetes we are referring to and maybe run through some of the numbers.
Sure. So when we're talking about diabetes in adult patients, we're talking about type 2 diabetes. Okay. It represents about 90% of all diabetes cases in adults. Mm-hmm. That's about, it covers about 10% of the adult population. Over 30 million Americans have diabetes.
That's a lot.
Yes.
That is a lot.
When we're talking about seniors, the percentage goes up even further. Wow. 25% of seniors have diabetes, both mm-hmm. diagnosed and undiagnosed, but okay. It's a significant issue.
It is. And let's talk about some of the causes.
So causes for diabetes, for type 2 in specific, we look at it as twofold. There's causes that you can change and causes that you can't really change too much. Mm-hmm. So things that you can do something about is lifestyle. How you eat. Are you eating healthy? Are you eating lots of sweets? Do you mm-hmm. exercise, or are you sedentary in your lifestyle? Mm-hmm. That's something that you could do something about. Things that are more passive that you really can't change would include your genetics, right? If diabetes runs in your family, you have a higher chance of becoming diabetic. You can't really change your family members.
Right.
And ethnicity tends to play a role as well. Mm-hmm. These are some of the major factors that are baked into your risk of becoming diabetic.
And what are some of the things that is happening in the body when you have diabetes?
So that's a good question. First, you have to understand how the body usually works. So when you eat food, the food goes down into your stomach and your intestines, and your body breaks that food down and turns it into sugar. Mm-hmm. That sugar then leaves the intestines and goes into your blood. An organ in your abdomen called the pancreas senses this high sugar level in your blood and produces a natural hormone called insulin.
Okay.
The job of this insulin is to take the sugar and help it move out of the blood into the cells where it's used for energy.
Okay.
The problem in diabetes is, there's two. The first is something called insulin resistance. Mm-hmm. So the insulin that your pancreas is producing is not as effective as it should be, and therefore the sugar levels stay high in your blood, mm-hmm. and that causes the problems in diabetes. The secondary problem there is at some point for diabetics, their pancreas can become tired or fatigued and stops producing sufficient amounts of insulin. So if you don't have enough insulin, mm-hmm. your blood sugar levels rise, and again, you have a problem.
Is that when the medication comes in, or can you kind of curb that with food or something that has sugar? Yeah,
so I always recommend lifestyle modification at any stage in diabetes. Mm-hmm. It's one of the best things you can do to stay healthy. So eating healthy, cutting down on condensed sweets and things like that mm-hmm. is very important. At Kaiser Permanente, we recommend the healthy plate method.
Oh.
It's very simple. You take one plate of food. Don't eat 2 or 3 plates of food for your meal. And you divide your plate up. So half your plate should be vegetables, and we recommend the non-starchy vegetables, so mm-hmm. salads, stewed vegetables, whatever you like. Mm-hmm. A quarter of your plate should be protein, so lean meats, non-meat protein is also very good for you. Okay. And then 25% of your plate should be carbohydrates, and we certainly recommend things like whole grains.
Gotcha. Okay. So let's talk about when you are visiting your physician, what do we need to know, like, or what do the physicians provide?
Okay, so a couple things. If you are a patient with diabetes or you have a loved one with diabetes, one of the most important things that you're going to want to know is my doctor providing the best diabetes care?
Right.
So a couple ways to figure that out. One, you ask around. You can ask the office staff or the doctor directly. That might not be terribly reliable. You know, there might be some bias there. So something I recommend for patients is to check with the National Committee for Quality Assurance.
Yes.
NCQA for short.
Okay.
This is an independent organization that rates the quality of medical care.
Okay.
So patients can actually go to the NCQA website. The website's reportcards.ncqa.org.
Okay.
Click on healthcare provider. And you can actually search for your doctor. If your doctor's there and has been certified by the Diabetes Recognition Program, you can rest assured that your doctor has proven to the NCQA, an independent organization, that they provide top quality diabetes care.
So could they just type in NCQA? Would that get them to
Yeah,
that
you could
page?
probably
And then they
Google
can find the
it,
report
yeah.
cards. Okay, good, because
Yeah.
I didn't put that up for them to see, but nonetheless, if they wanted to just type in NCQA or ncqa.org, they could get there.
Yes, and
Okay,
there's
perfect.
tons of information on all
Okay.
kinds of quality, including diabetes.
Okay, fantastic. And what does Kaiser Permanente do for diabetes that might be different than some other hospitals?
Sure. So first and foremost, we try to prevent diabetes. So we have a very good screening program looking for pre-diabetes and diabetes in our members. And we actually have a program called the Healthy Balance Program that's certified by the CDC as a diabetes prevention program.
Okay.
For our members with diabetes, we have a very comprehensive diabetes program. It starts with helping to educate the member on what diabetes is and what can be done to help it. You know, the more knowledge that you have, the more power you have in any disease, including diabetes. We have a stellar healthcare team, starting with your physician. We have healthcare educators, certified diabetic educators. We have specialized clinical pharmacists, nurse practitioners, physician assistants, dietitians, wellness coaches, all to help our members get the best diabetes care. We also have access to the latest medications, the latest technologies. We have remote glucose monitoring, one of the newest things in the diabetes field to help control diabetes.
And you can even do it through your phone now.
Yes, you can check your blood sugars and get all that information on the phone, and it even sends that information to your doctor and the care team so we can help make recommendations to keep the blood sugars under control.
Fantastic. And one last thing is, you know, Kaiser Permanente has an awful lot of programs, and one in particular, it's HEDIS. Tell me what that stands for.
HEDIS. That's actually a program through NCQA.
Oh, it is. Okay.
And so HEDIS is the that's a mnemonic. So
Healthcare Effectiveness Data and Information Set.
Yes, yeah, it's alphabet soup.
Yes,
it's
it is.
crazy. So that's all about determining what level of quality a healthcare organization might provide.
Okay.
You can imagine if you're trying to figure out if your doctor or your healthcare organization provides top level care, you know, it could be difficult. It's like comparing apples and oranges. You might get a flyer from one medical center and a mailer from another, and they all report the best findings. So organizations actually report specific data through HEDIS to NCQA about things like diabetes care. And that way they can be compared directly on a national level to see how your healthcare organization measures up in quality.
Okay.
I'm happy to report that at Kaiser Permanente, we actually do very well. We're in the top echelon for diabetes care. We actually meet something called the HEDIS 90th percentile for diabetes care. And that means we're in the top 10% in the nation. And even for things like related diseases to diabetes, we do very well. We have one of the top programs in the nation for retinal screening. Okay. So you may not know this, but blindness from diabetes is a serious thing in the United States. And it's very preventable. So screening for it is super important.
Okay.
We actually invested in retinal cameras to help screen our patients. So you might have seen these. If you go to like a private optometrist office, oftentimes after your visit, they'll say, hey, for another $50, we can take these digital photos of your retina and look for disease.
Oh.
We actually do that for free, screening our members for diabetic retinopathy, because it is the most sensitive tool that we have to look for diabetic retinopathy and help prevent that. So that put us in one of the top, I think we're top 2 in the nation in diabetes retinal screening. We're great at blood pressure control in diabetic patients. We're one of the top in the nation in terms of prescribing cholesterol medicines for diabetic patients. It's a recommendation from the American Heart Association and the American Diabetes Association that diabetic patients over the age of 40 should be on cholesterol medicine to help prevent heart attacks and strokes.
Wow. Wow. Well, excellent information. Thank you so much. And that retinal is very interesting. So, or the retinal screening. Retinal screening.
Yeah.
All right. Well, very good. Well, thank you so much. It was great to meet you.
Thanks for having me. I
You're
appreciate
welcome.
it.
All right. Thank you. And if you want more information about what we've just talked about, you can go to kp.org/Orange County. We'll be right back.